And that, it is my pleasure to introduce to you your presenters for today. We have Simon Dijkstra, who is a public health nurse who currently works on the nursing practice team at the public health branch at the Regional Municipality of York. And then we have her colleague, Michelle Sorley, and she is also a public health nurse. And since 2011, she has worked in a variety of public health and teaching roles. And she currently works on the nursing practice team as well at the public health branch at the Regional Municipality of York. So for those of you who are not familiar with BPSO, just in case you hear that, it stands for Best Practice Spotlight Organizations. And BPSOs are healthcare as well as academic organizations who are selected by RNEO through a proposal process to implement as well as to evaluate RNEO's best practice guidelines. So it is quite a dynamic partnership, and a lot of BPSOs do present at these monthly webinars to be able to share their experiences. And the focus is on making a positive impact through patient care and on patient care through evidence-based practice. And so now that you have that context in mind, I'm going to now pass it on to Simone and Michelle to start the presentation. So thank you.
Wonderful, and thank you very much. This is Simone speaking to you. And just going to see if my mouse will advance the slides. Here we are, lovely. I'm in control of the screen, love it. So good afternoon, and thank you all for attending our seminar today, reviewing our lessons learned from hosting our Best Practices Forum. We truly appreciate you taking the time out of your day to attend. I'd like to take a moment and thank both Andrea and Grace from the RNAO with their assistance in organizing and preparing for this day. I'd also like to take a moment and introduce my co-presenter, Michelle, and our head of nursing practice, Hamida Bamani, who's also on the line with us. Again, we do encourage you to please post any questions that you might have in the chat box, and we will be addressing all the questions at the end of the presentation. And so what we wanted to do is kind of set the context of our presentation. We'll be reviewing the following points. So reviewing the objectives of the forum, the format that we used of this forum, outlining who our target audience was, and then who attended the forum. We'll be reviewing the evaluation results, as well as looking at the successes and the lessons learned, and then reviewing our next steps. So we're going to start off by having a look at what our objectives are. And so what we wanted to do is really put on an engaging and interactive forum. And we had three primary objectives, which you can see listed on the screen. Our first one was to foster the engagement between the staff and the current best practices that were being implemented. We also wanted to raise the profile of best practices and those who are diligently working on implementing them. We also wanted to be able to highlight the importance of collaboration in ensuring the success of best practice implementation, evaluation, and sustainability planning. Now, by the end of our forum, we were confident that our attendees will have had an increased knowledge in the knowledge of best practices that were currently being implemented throughout our branch, who they should contact if they had a question with relation to a best practice, to have an increased understanding of their roles as best practices start to roll out throughout the branch, and then know who they should reach out to if they'd like to become involved in the implementation of our best practices. So we're going to be having a look at the format, and I apologize if the image on the screen does not come through to you. But essentially what we organized was 2 half-day sessions, and we wanted to ensure that we had accessibility for our attendees. And so we planned a session for the North region and one for the South. We also wanted to ensure that people had some sort of takeaway item. So much like you would have received when you attended conferences like TOPIC. We created a program guide. And this program guide provided information on the sessions, which outline the following information: the pechakuchas and poster titles, who the authors of these presentations and posters were, as well as an abstract. The program guide was made available in a hard copy form for those who attended, and there are plans to post this program guide on an internal sharing system for those staff to peruse at their leisure, but also available for those individuals who were not able to attend the session in person. You'll notice on the right of the screen, we have a breakdown of the agenda for the day, and we attempted to create an agenda that involved our audience and really wanted to engage them. Also for allowing for plenty of time for reviewing our posters as well as networking. You can see our key items here was having a little bit of a registration and light refreshments. We had an audience welcome and then an address from our Chief Nursing Officer. We had a best practices Kahoots game, which is also an interactive game. We had an address from our head of nursing practice, Hamida, with regards to our BPSO driving results. We had our elevator poster pitches, and then we had time for a poster walk and a break. We came back together again and had another best practices Kahoots game, and then we moved into our Pecha Kucha presentations. We had Mentimeter evaluations and then closing remarks. You can see on the screen the list of various poster presentations that we had. And we had our posters on family violence, abuse, prevention, and online curriculum, which was being developed. Breast Friends Peer Support Group. We have our Nurse Family Partnership Program. Leveraging best practice recommendations to enhance substance and tobacco screening. We have our assessment and interventions for perinatal depression. The integration of the RNAO BPG embracing cultural differences in healthcare. We also had addressing the SDOH, a unique smoking cessation initiative. We also had creating an infection prevention control best practice guideline. And this is something that we developed in-house. And the aim was to address the unique needs of the public health professional. Our final one was a time slice improvement project, and this was using data to optimize the standards of the intake process. We also had Pecha Kucha presentations. And for those that are not familiar what a Pecha Kucha is, it's a storytelling format where a presenter shows 20 slides for 20 seconds and a commentary on each slide. You can see on your screen listed the titles of our various Pecha Kuchas. So our target audience. We wanted to make sure that our forum was inclusive and available to everybody. So we made sure that our forum was open to all staff in the public health branch. And our invitations were sent to all of our best practice guideline work, all those members who were part of our best practice guideline network, and any staff who led customer experience best practices. We also made a distinct effort to make sure that we were engaging staff from various disciplines. So who attended? In the end, over the 2 days, we had 138 staff register and attend the event. The majority of registrants were public health nurses, and we did have some external partners attend, namely from South Lake Regional Health Center and Markham Stouffville Hospitals. And now I'm going to pass the screen on over to my colleague, Michelle, who's going to be reviewing the evaluation results. Michelle?
Thanks, Simone. So we use the Mentimeter platform to obtain anonymous results in live time from the attendees. We used this format in the past and have been successful in obtaining a higher evaluation response rate. So we built in 5 minutes at the end of our event for attendees to answer the questions that were shared on the screen. Mentimeter enables participants to see response in live time that participants have provided to the questions posed on the screen. So we had 62 out of 138 staff who were registered who participated in the evaluation, which yielded a response rate of 45%, which is quite good. So at the end of the event, we asked attendees to respond on whether or not they agree or disagree with the statement. And for us, most participants agree or strongly agree that they understand how to implement best practices in their work. The second question that we asked is, we asked participants to respond on whether or not they agree or disagree to the statement. Most participants agree or strongly agree that they plan to incorporate relevant best practices to my work based on what they've learned today. So the third question that we asked, what did you learn today that was meaningful to your work or practice setting? And here's an image of a word cloud with the most popular answers. There were 53 responses, and I'm going to highlight the main themes that we found in our responses. 14 individuals said that the program updates or overview of programs and their progress is meaningful to their practice. There were 12 responses on information on BPSO strategies, integration and implementation of best practices. We had 9 responses on collaboration within the department, division, and public health in general. There were 6 responses on information from the U=U presentation. So this was the presentation on emerging evidence that people living with HIV with an undetectable viral load cannot transmit HIV sexually. So some people found this very helpful. We had 5 responses on inclusivity, cultural sensitivity, and anti-stigma work. So there were a number of presentations that captured these concepts. We had 4 responses on the information learned from breastfeeding OTN presentations. So this is on virtual breastfeeding support. And we had 3 responses on information learned from the LGBTQS+ presentation. So this was a presentation on cultural sensitivity that one of our consolidation students created. So she had completed a previous presentation with us, and she shared this presentation that she created for her team during our forum. We also asked the group what worked well in our session today. And again, here's another word cloud of the most popular responses. So the main themes include 22 responses on the flow of day or pace of the presentation. 18 individuals liked the presentation. 11 liked the poster and elevator pitches. We asked staff who were presenting posters to come up with an elevator pitch to promote their posters to the group. 11 liked the variety of presentations and posters. 9 liked the networking opportunity and the ability to make new connections and collaborate with other staff. There were 6 responses on the interactive and engaging content of our forum. 5 liked the length of the session. 4 liked the location and venue. Another 4 liked the knowledge exchange component. 3 liked the opportunity to ask questions, and another 3 liked the interactive games that Simone mentioned earlier. And we used Kahoot to promote interaction. So it's a platform that we could create games on. And again, we've done this in the past and they've been successful, and attendees generally like these games. We also wanted to know how we could improve future sessions. So we received a number of positive responses indicating that the event was well done. So 19 said the event was well done, it was great, don't change a thing. We had one person say they wanted the same food and the same venue, and another who said continue to offer sessions with time built in to process knowledge learned. We also were wondering what areas of improvement to work on. So we had 2 responses requesting larger screens or a better view of the screen, and 2 responses requesting to invite community partners. Other suggestions included other professionals to invite, not just nurses, providing more examples of non-nursing based programs, inviting more frontline staff and students to participate, as well as more internal partners. They also suggested to include clients who experienced some of our services. The last question that we asked the group is we wanted to determine our Net Promoter Score. So a Net Promoter Score is a percentage of customers, so in this case, our event attendees, rating their likelihood to recommend a company, product, or service. So in this case, it's the best practice forum to a friend or colleague. So this number is found using the percentage of promoters minus the percentage of detractors. And the score ranges from -100 to +100. And we received a score of 84, which is considered world-class. So we had a great score, Net Promoter Score from this event. Now we're going to talk about some of our successes. So based off of the evaluation results, our successes included the format of the forum. So this includes the venue and location, the flow of day and pace of presentations, the variety of presentations that we had, and the ability that we allowed nursing students to present their work. We also said that successes included elevator pitches and poster presentations, networking opportunities to make new connections, promoting an opportunity for collaboration, and using interactive Kahoot games and Mentimeter evaluations. Here are some lessons learned. We learned that it was important to celebrate implementing a best practice initiative, and that it was important to have a forum to exchange knowledge and ideas. And it was also important to share initiatives that you're working on, because this raises awareness on the initiatives happening in public health. It's also important to provide opportunities for networking, which promotes collaboration between teams and divisions in public health. And it's also important to engage champion leads who are outside of nursing disciplines and to use an interdisciplinary approach. So now we're going to talk about some next steps. Based on the suggestions of staff, future best practice forums will explore inviting more staff and students, increasing capacity for event attendance, inviting other healthcare professionals working in public health, providing more best practice examples in non-nursing based public health programs, and inviting clients, community partners, and internal partners. Before we go, we want to share our contact information. So this email address here will send an email to the nursing practice team at York Region. Simone and I are heavily involved in the COVID-19 response, but if you have any questions, feel free to send it to this email address, which is monitored, and we'll make sure that your email is going to get responded to in a timely manner. So that's everything for our presentation. We're going to open it up for any questions.
Excellent. Thank you so much, Michelle and Simone, for that presentation and for highlighting for us the importance of networking and providing a common forum for individuals and community members to learn more about best practices. So does anyone have any questions they would like to share? And please feel free to type them in the chat box and to indicate all panelists and attendees, or if you have any comments or questions. I do see one here. I'm going to read it out to the both of you, and then please feel free to chime in, either of you, Simone or Michelle. If you were to repeat this type of event, what do you think you would do differently as a planning committee?
Okay.
I think, and chime in with me here, Michelle. I think, I think time of this, like the time of the year, is important to consider. Because, and I think we did it in the early spring, which was a nice time, wasn't it, Michelle?
I thought it was I know it was snowing on one of the days, so it could have been.
Was it snowing?
Yes. So I was thinking.
Snow on, it can snow on May 2 or 2.
Our weather's so unpredictable these days.
Mm-hmm.
But I was thinking as well, the timing, if you had it maybe early fall or late spring would be nice. Mm-hmm. So if there are any weather issues, it would be more accessible for staff. And I also wrote finding a bigger space that could house more people to come to our event would also be helpful as well.
Absolutely. You want to take into consideration parking as well if people are going to be driving to attend your event.
Okay, excellent. Thank you so much. And please continue to send your questions along the way. I did notice on the program, and I believe it may have been February, and I mean, a lot has changed since the time that you have done this best practices forum. Was there any consideration, and I know context is very important here, in terms of doing something virtually, even if people are not able to come together in person?
I know we also looked at having the event virtually for those who couldn't physically come. But that's something that we're going to explore, and that's a great suggestion for the next event.
Mm-hmm.
Yeah, and if Grace, this is Hamida. I
Yes.
just wanted to add, we've had extensive experiences now supporting our nursing staff and other professional staff to learn in a virtual environment. So what we're using, and Michelle and Simone can add to this, is that we're using a variety of different tools that we're going to now utilize more broadly within the BPSO area as well. So currently, a lot of our team has been deployed to support public health within the COVID response. So we're leading the orientation work. So we've learned quite a lot there. And some of the practices we're using right now is we've gotten very used to using the Teams features and Microsoft Teams. So we lead lots of conversations, orientation, sharing of knowledge using the teams. The other piece that our team has done is we've developed an online SharePoint website for all orientation material. So we can utilize that for also best practices work in the future. So that's another thing where, we can post materials that staff can go into on their own time. And independently vet through that. And another piece that we've gotten to really utilize well is developing video modules where we put together information, and we've started to now work with staff who we support in developing these video modules as well, related to specific topics that we're exploring in COVID. So those are some ways where, we're gonna bring that forward when we are thinking about the next time we're going to do a knowledge piece, exchange piece, or knowledge sharing piece around the BPSO work.
Mm-hmm. Okay, those are excellent examples, especially considering, the context that we're in today. And again, Hamida, I think you highlighted the importance of there not being a one-time event, but continued engagement of staff when it comes to best practices and different ways to be able to facilitate that depending on the way they learn. So thank you very much for sharing. There is another question here. First off, great job, Simone and Michelle. To achieve a forum of this nature requires the engagement and leadership of both senior leadership, team, and frontline staff. How does the workplace culture at York Region contribute to the success of this event?
Well, I would say that York Region really does have a culture of collaboration. People working together to achieve common goals, working across the various disciplines. We also have a culture of curiosity and wanting to learn more, to investigate further. Hamida, Michelle, is there anything that you wanted to add?
We're also very lucky that our senior leadership really values having protected time to have events like these where we can learn more about different initiatives that people are working on, and we have opportunities to collaborate whether on current projects or future projects. So we're very lucky to have that.
And to build on that, I think those are exactly the pieces that we've used. We've also got, I would say, from a senior leadership perspective, a branch plan. So the public health branch in York Region sits within the Regional Municipality of York. So we have a branch plan, and as part of that, best practices and adoption of best practices is a strategy that we want to implement as an organization. The other big area that we have support from is that we really focus on continuous quality improvement. And because of that, the linkage to best practices, makes good sense. So those are two areas that give us support. And when you have, as you know, when you have leadership support and commitment, then it has a major impact, on how we, how successful we are. So those are a couple of things that, we utilize to trampoline ourselves forward on the BPSO work. We have had a best practice guideline network in place at York Region Public Health for a lot, I would say at least 4 to 5 years before we applied to be a best practice spotlight organization. And so that really also is part of our culture, I would say, that's embedded in our culture. And I think that led to, having that kind of a foundation has led to much of our success. And as you can see, when we're engaging in knowledge exchange work, then we have the support and we have a structure. And the way we just developed a best practice guideline network was that we involved not only nursing staff, but we involved other disciplines. So in public health, we have public health inspectors, we have nutritionists, we have registered dental hygienists. So all those areas were engaged in the best practices work. So I guess what I'm saying is, from a strategy perspective, we had a good support and clear strategy that indicated that this was important to the organization. And then we had structure within the organization, structures like the best practice guideline network. And the last piece is we have a chief nursing officer, as Simone was mentioning. So then, with that, we have senior leadership support, advocating for use of best practices in our work. So that also goes a long way.
Okay, excellent. So it's an indication that there was board to bedside, well, essentially to frontline engagement in terms of this. And I think that reflects in the best practice forum that you held, and the number of individuals, I'm supposing, or programs that were involved when it came to the Pechakucha as well as the poster gallery. How did you go about recruiting people? How easy it was, or how did you go about getting that level of engagement from a presenter point of view?
I believe we sent a few emails out promoting this event and requesting people to submit an abstract. So we sent it out, I believe, first to the Best Practice Network and then to the General York Region Public Health Group. We also have the Nursing Student Preceptor Program, where we advertise this event to our students. And we also encouraged our nursing students to submit any abstracts that they wanted to present to the event as well.
Okay, excellent. And in follow-up to that, I was wondering if anyone had any questions or comments. Please feel free to add them to the chat box. Because it seems like you're the staff, and as you said, Simone was saying, is that you have a culture of collaboration, and Hamida was saying that there's a lot of engagement and there's a network involved. So that 45% or so evaluation response rate, because surveys can be challenging to fill out, is really good. So it's an indication of the engagement. And just wondering about what you're going to do with that evaluation feedback. You did have some lessons learned as well as next steps. Not only in terms of a next best practice forum, but there were also some general questions about the use of BPGs in practice and whether they felt that, it was useful or not. So I was just wondering how that kind of information is going to be leveraged going forward.
So Grace, whilst Michelle and Simone are thinking about that, the previous question, the other piece is that the nursing practice program, like Michelle and Simone and Aaliyah on our team, really worked hard to keep things simple. So the abstract form was quite simple for people to complete. As they were thinking of participating, we did a lot of shoulder tapping, right? We touched base with either the managers of certain teams saying, hey, you're doing some interesting work around best practices. We'd love to hear from you. We directly touch base with staff who are in leadership, who take on leadership roles and are interested in best practices. And we gave them templates to complete for the posters so that it's easy. They knew what they had to complete. And we supported a lot of the work around proofreading things, looking over people's submissions, if they were doing a Pechakucha, giving them informal feedback, coaching. So all those things at the back end, the nursing practice team did in order to get people, going where we needed to in order to make this a successful knowledge exchange event. So wanted to add that there, and I'm going to let Simone and Michelle take a stab at the question you just asked. In terms of Grace, you were asking how are we going to utilize the learnings or the people's interest in best practices?
Oh, I just noticed there were a couple broad questions when it came to the evaluation survey in regard to the use of best practice guidelines in their practice. And I was just, because there were questions that are more specific to the best practice forum, and then there were broader questions. So I was wondering what you're going to do to the responses to the broader question about best practices. Unless I'm misinterpreting the...
No, you didn't. We did broaden it to beyond the RNO BPGs. So I'm going to let Michelle and Simone, and then I have some ideas about the question as well.
I remember we kept it broad because we wanted everyone to feel included. We know people are working on best practices. They may not be specifically best practice guidelines from RNAO, but we wanted to keep it general. But we also knew that we were working towards BPSO, and there were individuals working on some of those initiatives as well. So we wanted to showcase both groups so that we were promoting a culture of inclusion.
Excellent.
Yeah, and the other thing I'd say is, when you're looking at best practices, right, public health is mandated by the government according to our public health standards, that Ontario Public Health Standards, right? So we're supposed to look at knowledge, and we're supposed to continually, as part of public health work, continually look at best practices. And so this is kind of part of our, as I would say, it's an expectation in public health. So we have lots of other areas, right, beyond the RNAO best practice guidelines that are very specific to public health context. Some are clinical areas that Michelle was mentioning in the presentation related to our sexual bloodborne infections area, right, SBBI, and there's not always a clinical guideline that accompanies that work, right, from RNAO. So we did broaden it because as part of our ethos, it's part of our expectations from the government as public health that we would continually be looking at best practices to shape our work.
Excellent. Thank you so much for sharing. And Simone, did you had wanted to add to that, or were you okay?
I think my colleagues covered it well. You want to make it as open and inviting, as inclusive to as many individuals and disciplines. You want to try and remove any sort of barriers to participation, whether it's hesitancy or nerves or whatever. You want to really make it as easy to join in as possible.
Exactly. Thank you so much. I really like the inclusivity and the recognition of best practices as a whole. And, because when we teach champions such as yourself and people in the audience about the knowledge action framework, as well as the social action movement framework, it's in regard to the application of best practices, although we teach it in the context of RNAO BPGs. Alrighty, so I think we're going to wrap up here, but I just wanted to give Michelle, Simone, and Hamida an opportunity to provide their last thoughts. So if you were to want the audience to take away from this presentation, what would be that one big keystone message be? And perhaps we can start with Michelle.
I would say that it's very important to have protected time to share lessons learned, and even have an event like this just to network and to learn more about the initiatives other people are working on. Oftentimes we work in silos, but an event like this is great to have so that we could see what's going on in our community and to see where we could how we could work with others on different initiatives currently and again in the future.
Excellent. So thank you. Facilitating the collaboration and the networking. Simone.
I would say, to tail on to what Michelle was saying, an important thing would be to acknowledge those successes, be them great or small, as you are implementing and rolling out BPGs. It can be quite a daunting process, and so you have to make sure that you acknowledge and celebrate those individuals who are working tirelessly to roll and make it meaningful to their colleagues.
Excellent. I agree. Celebration and recognition for the hard work and the progress that's made is very important in terms of change management. And Hamida.
I would say it's also a moment of pride for nursing. As part of our nursing profession, we know that we're supposed to continually look at client care, look at the best way of engaging our clients and communities. And I think this allows us to lead in a collaborative manner in our organizations. And I think that's really, really important that we take the opportunity to take leadership positions such as these, right? Because nursing practice program, I'm not sure in other sectors, it tends to be small teams, right, with limited resources, but then the impact when you do something like this is much larger. So the impact is larger, and also I think it's a recognition for the skills and the capacity and the leadership nurses bring forward to our day-to-day, work with clients and communities. And that's really, really important too.
No, that's excellent. I really, that, the philosophy of embracing a developing point of care leadership and being visible as leaders in the field, I think is always an excellent opportunity for nurses. So thank you so much, everyone, for the excellent presentation and for the engaging discussion. Just wanted to personally thank Michelle, Simone, and Hamida for being here today and for sharing your successes with regard to the Best Practice Forum and sharing your lessons learned so that we can all learn from your experiences as well as follow up with you graciously with any questions that we may have. Just wanted to let you know that all the registrants are going to get a copy of today's presentation, and it will be recorded as well. So it's going to be posted on the RNEO website. As always, we seek your feedback as part of the PDSA. We want to practice what we preach. And so we also want to be able to collect that information and hear from you as an audience as to what other topics you'd like to hear about. And if you have any questions, please contact Andrea Stubbs, the project lead of the Champions Program, astubbs@rneos.ca. And to the panel, Naomi and other individuals, Kari, are saying thank you so much for an excellent presentation. And everyone's very grateful for you doing your presentation today. So thank you very much, everyone. Have a great afternoon and be safe. Bye-bye.